Good evening, everybody. Thank you so much for joining me once again here on Food from Zanzi's hashtag Gather to Grow. It is an absolute pleasure to be back. It's been a minute, but I'm here and I'm so excited to be back with you on this platform where we all get together and grow together as agriculturalists, as farmers, as people working within the agricultural sector, and of course, lovers of Food from Zanzi and all the amazing work that Food from Zanzi is doing within the agricultural space. I'm so happy to be chatting to you this evening. Our topic tonight is rabies prevention and control in livestock. I think this is such an important topic, and I chose this topic specifically because, rabies remains a significant threat to both humans and animals in many parts of the world. And on the 28th of September, which we commemorated World Rabies Day, and that's why I thought that this would be a great topic to kind of share. Food from Zanzi has shared a lot of insight on this topic already. And this evening, I'm so happy to be welcoming our speakers, experts in this field. So firstly, it's Dr. Didi Klaassen. She's from AfriVet, and she's such an amazing person, always open to sharing information. So she's the general manager of AfriVet's training services, and she's also the vice chairperson of the Rabies Advisory Group. So I'm very happy to be welcoming her and looking forward to chatting to her, as well as her colleague within the same field. Dr. Gabriel is the Rabies Advisory Group representative for the Eastern Cape province. So happy to be able to chat to them. Perfect, Dr. Didi. So, immediately ask you just to tell us a little bit more about you. Thanks, Dr. Didi Klaassen.
Thanks, Dawn, for having us and for discussing such an important topic. I think rabies is a disease that sort of comes around and into the media around September when it's World Rabies Month, and we tend to forget about it. For livestock, it's an important disease, but the focus is usually on dogs and cats, where it should be. But it's important that people involved with livestock know more about the disease, because it can affect them and their families. So I love what you guys are doing at Food from Zanzi to create more awareness, especially for livestock owners. And so my background is I started off in private practice for a short time, and then I worked in government, and that's where my passion for rabies started, and the control thereof, and that's how I got involved with the Rabies Advisory Group. And then after 8 years in government, I moved to AfriVet because it's a South African company with a massive passion for the people of South Africa and training, and with a strong focus on livestock and growing into the companion sector. And this is how I got involved with training services. So our function and our day-to-day job is to provide training for people in the agricultural sector. And in the, now, as I said, we're growing into the companion sector, but to provide training that people know how to farm, how to optimize their farming operations, and how to use medication correctly so that they can farm better. So, yeah, and I'm still involved with the rabies scene because it's such an important disease, and we literally save lives with more information that we get out.
I almost think it's one of those things that if you're not like directly impacted by it, you almost ignore it. But that's not the case. People should be more aware. Hence the discussion that we're having this evening. Dr. Gabriel is, of course, a state veterinarian in the Eastern Cape, and also part of this advisory group that Dr. Didi Klaassen just spoke about. He's just trying to connect with us. I'm going to kick off with a question so we can at least get this conversation going, and then he can join us as we're chatting about it. Maybe we can talk about how common rabies transmission in livestock is, and, which species are most vulnerable on farms.
Basically, rabies, the virus, can affect any mammal. The important species, as I mentioned, are dogs and cats, because they are very close to people and they live in our houses and they come into close contact. And that's why government emphasizes the vaccination of dogs and cats. But because we have rabies circulating in wildlife pools, our livestock who's out in pasture grazing, they are more sort of open to encounters with wildlife. And there's specific areas in South Africa where rabies is more common. So if we look at where dog rabies is reported more frequently, it's more towards the eastern side of the country. So we're talking about KwaZulu-Natal. There's Dr. Gabriel. KwaZulu-Natal, the Eastern Cape where Dr. Gabriel is from, and why it's so important to have him here this evening, Limpopo Province, Mpumalanga. And where I was a state vet in the Free State, we had a lot of rabies, especially in sheep, on the Lesotho border. So it can literally be cattle, sheep or goats, whatever livestock you're farming with. If they encounter wildlife with a wild animal that has contracted rabies, they can contract it as well. And then obviously, if there's a human involved, you are at risk too. So if you're farming with livestock and you sort of at pasture, then they can contract rabies. And saying that, we've now had recent cases of dairy cattle in the Western Cape that contracted rabies. So if you're in the Western Cape, don't go, oh, not my problem. There's bat-eared foxes and aardwolf that are reported with rabies, and our seals as well. So be cautious that you don't ever say in South Africa, oh, not my problem with rabies. There are areas where we see it more frequently in livestock, like cattle in Northwest and sheep in the Free State. Dr. Gabriel can comment more on what's happening on the Eastern Cape, but be cautious and be on the lookout for it.
Thank you so much for setting the scene, Dr. Didi Klaasen. Welcome, Dr. Gabriel Mutero. He's, of course, a state veterinarian in Grahamstown in the Eastern Cape Province and also part of this advisory group that we mentioned as part of our introductory comments around this topic. Dr. Gabriel, maybe just a bit of background about the work that you're doing within your province and more about you as we kick off the conversation for those that might not know you, sir.
Thank you for inviting me to this important show. I think I just want to emphasize what Dr. Klaasen has said, that rabies is one of the quite important diseases, but also, unfortunately, one of the ignored diseases. It's an important zoonotic disease that is highly fatal, that can actually kill people and kill animals. But we rarely talk about it. We usually talk about it a lot in September during the rabies month. But I think it's something that we need to constantly talk about. So thank you so much for this important meeting that you have invited us to. So as for myself, my name is Gabriel Mutero. I'm a state veterinarian employed by Department of Rural Development and Agrarian Reform here in the Eastern Cape. So our basic job here, basically our basic task is to diagnose and control controlled animal diseases and other diseases that can actually wreak havoc in the farming animal communities. And one of those things is actually vaccination of dogs, advising people on responsible pet ownership and many other things.
Thank you so much for that information, Dr. Gabriel. What are the early signs or symptoms of rabies in livestock, and kind of how can farmers recognize them if they're not aware of it to begin with?
So rabies, the disease, is actually caused by a virus that we call rabies virus. And this virus actually likes the nervous system or the brain. It's a disease of the brain. So most of the signs that we see are signs that show that the brain has been affected, nervous signs. So some of the early signs that we see usually in animals, in humans, is usually a change in behavior of animals. So sometimes we see animals becoming like animals that are normally active and aggressive, they become docile. And if it's wild animals, normally wild animals, they fear humans. But usually in this early stages, sometimes they lose that fear of humans. They start encroaching into our neighborhoods and coming into our homesteads and all that. So those are the signs that we usually see. Then the other things that we also see is animals, they start hiding away from their human companion. They start hiding away. Then they start getting irritable. Sometimes if you look closely, sometimes you see the eyes are actually, you get open wide and the pupils are quite dilated. And then they start losing appetite, they start eating less. So those are the signs that we see usually in the early stages. Then we go into the next stage that we call usually the excitation phase. Usually in that stage, usually the animals, they start, like from the name of the disease, like we call it mad dog. The animals start getting mad, okay? They start becoming mad, they start barking uncontrollably, they start getting so excited, they become restless, they become aggressive, they bite anything on sight, they bite fence posts, they bite rocks, they bite trees, anything that is in sight, they start biting. Any non-food objects, they start biting. Then usually sometimes, as I said, like if it's wild animals, sometimes they start encroaching into our neighborhoods usually. So usually after this excitation phase and this furious form, the furious phase of rabies that I just talked about, they go into usually the final phase usually where there's paralysis, where basically the whole nervous system has been affected and the muscles can't move anymore. They go into paralysis. And usually when they are paralyzed, usually they die from this stage. And unfortunately, animals, once they start showing those signs, unfortunately, they cannot be treated. There's no treatment available.
It sounds, very bad, even the way you're describing it. I think as someone who loves animals, it's very difficult to see, I guess, if you have a pet or an animal that's going through this specific thing. Now, my next question, maybe you could take this one, Dr. Claassen, is just, how does rabies typically spread to livestock, and what role do the wild animals then play in this transmission?
There are, in our wildlife sector of rabies, if I can call it that, there's the mongoose strain, or mongoose virus, so that circulates between different mongoose species. That's typically seen more in the Free State, parts of the Northwest and Northern Cape. And then jackal rabies in the wildlife is also cycling with the dogs. So blackback jackals in the Limpopo provinces, parts of the Northwest, it also plays a very big role, the blackback jackal. In the Northern Cape, we see more aardwolf, and then the Western Cape, as discussed, it is mainly bat-eared foxes and our seals in the wildlife population. But then dogs, and I think that's why Dr. Gabriel focuses so much on the symptoms in dogs, because your normal domestic dog plays a massive role. We don't really have free roaming or feral dogs in South Africa. Most dogs are owned, but they roam around during the day, and then they can contract rabies from wildlife or other dogs and then disseminate it when they go into your herds. So what we've seen is the different, if you have a rabid mongoose, they will obviously, like Dr. Gabriel said, lose their fear. Same with the jackal. I've seen horrible videos where a rabid jackal will go into a herd of cattle, and then the cattle is just doing what they usually do, trying to protect their calves, and then they attack this rabid jackal. The jackal keeps on biting them on their legs and their faces, and different cows at a time as they're trying to protect the herd. And then because rabies needs to travel, as Dr. Gabriel also said, through the nervous system. So from the area where this animal is bitten, it needs to travel to the brain. And that's why we can't, like with the flu, we say you make contact with the flu virus, 3 days later you're sick. With rabies, it can vary very greatly, from as short as a week, we've seen with some of the dogs in the Eastern Cape, to months. I've had cases where the cattle were bitten 9 months before they started showing symptoms. And within a herd where a jackal came in and started biting them in different places, you could have cows starting to show symptoms now, and then months later another cow on the same herd can show symptoms. So it's a very complicated disease because of the slow dissemination and the long incubation period within the body, and also because so many different wild animals can carry it around. We had a case of what do you call it in English, a honey badger attacking a woman in Muldersdrift just here in Gauteng. So any mammal, wild or tame, can contract rabies. So and they can, if they can get contact with your herd, they can disseminate the virus, and you will see various symptoms over a varying period of time. So it is complicated, but if you know it's there, you need to do something about it.
And honey badgers are quite relentless, even without,
On a good day. Yeah, no, that was a horrible case. Yeah, no, it was horrible.
I now really understand the importance of kind of sharing information. I think I've understood it since we first started these conversations with you, Dr. Claassen, on Food from Zanzi. But I think, yeah, for if we could move it back to, our farming audience and farmers is watching us, how is rabies then transmitted to humans through infected livestock, and what precaution, should farmers take if they're aware that it's now happened, they have an outbreak of rabies on their farm? What should they do to protect themselves, agricultural workers, and the farming community on that specific farm or area?
So the majority of cases, usually the majority of transmission in terms of rabies, how it's transmitted from animals to humans, the majority of cases are usually through bites, where saliva is transmitted into the tissue of animals. Like what Dr. Claassen said, once that virus is in the tissue of animals through that bite, then it travels up the nervous system to the brain. So the majority of cases, between 95 and 99%, are through bites. Okay. Then we've got a few other cases that can be transmitted through, like, for example, when farmers are skinning animals, if an animal has died and the farmers don't know that this animal has died from rabies, then they are skinning the animal, they've got cuts or bruises on their skin. If those bruises get in contact with nervous tissue of that dead animal, they can also contract rabies as well. Then also we have cases, usually sometimes one of the signs that we see of rabies in animals is they show this sign that is like there's a bone that is stuck in their throat. And farmers want to save their poor animals. They stick their hand into the throat to try and retrieve that bone, whatever is blocking the throat of the animal. And in the process, they can also contract rabies as well. So those are the many ways in which rabies can be transmitted. Rarely also rabies can be transmitted usually through other like mucous membranes, like through our nose and through our eyes in rare cases. But usually in cases like this, usually it's us people that are working with rabies cases, like when we are opening the brain and all that. But for farming community, mostly it's through a bite or through scratches and contact with saliva from those rabid animals or the animals that are infected. So in terms of farmers, how can they prevent, what precautions can they take in terms of preventing themselves contracting rabies? Basically, the first thing that they need to do is to be very cautious when handling animals. I like what Dr. Klassen said, like, as we said, the whole of South Africa, rabies is endemic. It's spread throughout the country. There are some areas that we call hotspots where there's more rabies than others. But in all areas, we should treat all animals with caution, especially wild animals. So we should avoid usually like trying to pet wild animals. Or even stray dogs. If we see a stray dog acting strangely on the side of the road, we should avoid trying to pet it and trying to touch it. Things like even animals are fighting, we go there and try to separate them with our bare hands. We should avoid those things as well. And then if, for example, you suspect that this animal is rabid and everything, you should seek veterinary intervention as soon as possible. You should contact your nearest veterinarian. You should contact whether private vet or government veterinarian, animal health technicians, vet nurses, welfare organization like SPCA. You should contact them, then they can handle the situation from there. If you can isolate the animal, it's best if you can isolate the animal, try and isolate the animal away from other animals, away from humans. Then that way we can actually prevent rabies coming from the animals to the humans.
My next question, just around, vaccinating livestock against rabies, how often should that then be done?
Okay, no, that's also a good question. I just want to say, I think Dr. Gabriel covered it very, very nicely. I think most of the time we get hurt when we try to intervene in cases. So if you see something behaving strangely, rather get help and let experienced people try and handle it and ascertain whether it's a safe situation or not. But with regards to vaccination, there are several vaccines in South Africa that is registered for rabies in livestock. So just make sure you speak to a veterinarian. So government has various drives, vaccination drives and campaigns, and there were many held now over the month of September. Private practitioners also reduced rates to make sure that dogs and cats can be vaccinated. It's legislation in South Africa that dogs and cats must be vaccinated against rabies, mainly because of their close encounters and engagement with people, but also then the fact that they can encounter wildlife. So that's government's mandate, is to make sure that the people remain safe and that we vaccinate dogs and cats. But if you own livestock and you're in a province like the Northwest where rabies is more commonly reported in cattle, I think in Northwest there are more cattle testing positive for rabies than dogs and cats. So in that province, and if you have livestock, it would be advantageous for you to make sure that your cattle are vaccinated against rabies. But obviously that's not a government mandate. So what you do then is you speak to your local veterinarian and you ask them to incorporate that into your herd health program and your vaccination schedule. And then just make sure that the vaccine that you use is registered to be used in your specific livestock species. So some vaccine is registered for dogs and cats only. Other vaccines are registered for, let's say, cattle, sheep and goats. Others are vaccinated for horses as well. So whatever you are vaccinating, make sure that that species is listed on the package insert. And then the doses differ between the different vaccines that are registered. So make sure that you give the correct dose at the correct periods of time. So some vaccine will say you need to vaccinate at, let's say, 6 months, and then you have to boost again after a year. So follow that protocol according to the vaccine, because there's not a standardized vaccination protocol like there is for dogs and cats, which is built into legislation. And because of the differences in maternal immunity, that's the immunity that the animals get from their moms in the colostrum, that can play a role in how the vaccine works. So just follow the package insert religiously. Make sure that you have discussed this with your veterinarian, and you do get multi-dose vials, so it doesn't have to be expensive to make sure that your livestock is vaccinated. But do it with a veterinarian or an animal health technician, that you can make sure that what you're doing is done correctly.
Thanks so much for that. I think that's a very important aspect, and make it part of your production planning. When you're planning your farm, this is a very important aspect when it comes to managing your livestock generally. So thanks so much for that, Dr. Claassen. Now, are there specific kind of regional environmental factors to consider if there's an increased risk of rabies on farms? And why are certain areas or, certain provinces, why is it more prevalent than other provinces? If you could just kind of give us some context to that. Thanks, Dr. Gabriel. And Dr. Claassen can also comment afterward. Thanks.
Can I kindly ask Dr. Claassen to take this one, then I'll take the next two?
Definitely, Dr. Claassen.
There's various things that play a role here, and I think there's a lot of research that we can still do to understand this even better. So if you look at the distribution of your wildlife species across the country and the human distribution, so one of the things we discussed about the massive outbreak of rabies that we had in 2021, 2022, 2023 in the Eastern Cape was because of human dynamics. So there were areas in the Eastern Cape that had rabies, sort of it's been reported there, and then suddenly we had these massive outbreaks in the urban areas, and that was because of human movement, and COVID played a role. So people didn't keep their vaccinations and their pets up to date as they would have previously. So human and social behavior plays a massive role on where we see outbreaks and where hotspots can move and change around. So for example, the Western Cape, we've never had canine or dog rabies in the Western Cape prior to 2 years ago, when two random dogs tested positive the 1 year, and then suddenly this year we had another dog, but that was from seals. So the point I'm trying to make is humans and our movement play a role, and we see a cute little puppy that looks homeless next to the road, adopted, and it might be incubating rabies, bring it back to Pretoria. So our movement play a massive role, and then also the wildlife dynamics within your province. So in provinces where you have a lot of black-backed jackal, you will see it more commonly. In other areas where you have more mongooses, you will see that more commonly. So it depends on what you find in an area that will play a role, and then also human behavior. And as we've been sort of emphasizing the whole time, dog rabies is very important for maintenance of the disease, and there's a lot of drives to eliminate human deaths due to dog rabies by 2030. It's a global drive to get this done, and it's because dogs play such a massive role in humans contracting rabies. So the provinces where we see more dog rabies is more towards the eastern side, but if you think about population dynamics, the Northern Cape, for example, is more sparsely populated human-wise. So there might be rabies cases we're not even aware of because people didn't see the aardwolf with the rabies. So it's complicated. I don't have an easy answer for that, but humans, we cause our own trouble. But I don't want to say that out too loud. But if you vaccinate your dogs and cats, you protect your family. So then you're part of the solution. And hopefully we can stop people dying from rabies by 2030 in South Africa as well.
Dr. Gabriel, would you like to add something? I think we all have a role to play, and we all have a responsibility. So I think that's a very important point to make, and hope no one is offended by that. Dr. Gabriel, your comments on this as well?
I think she's captured it very well. I think the take-home message there is we need to vaccinate our pets. We need to vaccinate our dogs, because 95% of rabies cases that will happen in humans, they come from dogs. So if you can vaccinate the dogs, then if the dogs are protected, then they will not transmit it to the humans and even our farming animals as well.
We've spoken a lot about obviously what rabies is, how it affects humans, but let's talk about the Prevention Act. So if you do contract it, it's curable, so you can take medication for it. How does it work exactly? Is that the case, doctor?
Rabies, I think as I mentioned, once the signs start showing, usually, unfortunately, it's fatal. But the good news is rabies is 100% preventable. it can be prevented. So like for the general population, usually the vaccine is not recommended unless you are going to be visiting an endemic area or you are visiting a wildlife area, then you can vaccinate. But for people that are working with animals, they're like veterinarians, animal rangers and everything, it's recommended that they vaccinate to protect themselves. So if someone has been exposed to a rabid animal, someone has been bitten by a rabid animal, so the most important thing that they need to do immediately is to wash that wound for several minutes, up to 10 minutes, wash with soap and water. Then immediately after that, visit their medical center and explain the situation, what happened, what was the circumstance around the bite and everything. And then the medical professionals will start administering treatment. The treatment is there. The moment you start that treatment, rabies can be 100% preventable. But unfortunately, sometimes because of other things, other various factors that may come in, people usually don't seek in medical treatment early. Or sometimes they do seek in medical treatment and then they see because the treatment actually sometimes lasts up to 21 days or 28 days. But then after day 5, they see no, they don't have any signs of rabies. Then they stop the treatment. They stop treatment. And the moment they do that, usually sometimes later, they will get symptoms of rabies and unfortunately, they do pass away. So the rabies is actually 100% preventable if we seek immediate medical attention. There is vaccines that are available that can treat humans that have been exposed to rabies. The important thing is to seek medical treatment as soon as possible.
Thank you for that, Doctor. Any comments on that, Dr. Klaassen?
What we see a lot of times is because rabies is not something that's commonly seen, people will seek medical attention and the people will say, no, wait for the test results, then we'll start the treatment, but that's not correct. So if you've been bitten by a suspect animal and the veterinary team is busy investigating that and your risk assessment indicates that, listen, this is high risk for rabies, start the post-exposure protocol immediately. Don't wait for test results. And then once we have the test results, obviously you can continue or discontinue depending on what's happening. But as Dr. Gabriel said, please go seek medical attention and don't wait for test results. Sometimes it can take up to several weeks due to random things like couriers losing samples or, the life happens, but don't wait for your treatment to start.
Yeah, thank you so much. Now, just my last two questions is just around, economic impact of rabies outbreaks, specifically now on livestock and kind of how farmers, I think we've covered this already, but just last comments on how farmers can kind of mitigate these risks, because obviously there's those animals, obviously you can't do anything with them. You have to destroy them, right? So you can't keep them. You can't really use the meat at all. It needs to be destroyed completely. So if you have a herd of cattle that's affected by it, then that's a loss for you. If you can just maybe touch on the economic, impact of rabies outbreaks on livestock and for livestock farmers.
The first one is the one that you just touched on now in terms of, you said the animals who die. So that actually immediately, that's a major loss to farmers usually. Like the one, I think the Dr. Klaassen mentioned the video where Jaka was like being horned by several cows and everything. And unfortunately, sometimes several cows can actually be exposed to rabies. Then a farmer can actually lose several animals, sometimes not immediately, but over several weeks. And that's thousands of rands of that we are talking about. Then not only that, sometimes there's also even sometimes loss of human life as well, which we cannot even quantify in monetary terms. Then there is the cost now of preventing the disease happening, like in terms of biosecurity, in terms of maintaining the fences and all that. Then sometimes there's also the control measures that we put in place. When a place has got the presence of this controlled disease, sometimes we put restrictions, and those restrictions can limit things like movement of animals, which means farmers sometimes cannot attend shows. Social events are affected. They cannot attend shows. They cannot take their animals to auctions because everyone knows that there was a rabies case in that farm. Like what Dr. Klaassen explained earlier, that the incubation period can be quite long. So sometimes we don't know that there are some animals that are still incubating. So there's movement restrictions that will affect things like shows, things like sales. Then even international trade as well is affected. If that region or that farm is affected by rabies, we cannot sell our animals internationally. So it's very important that we try and prevent rabies happening, to prevent all these things happening, all these negative consequences happening.
I think we've covered so much of our content that we were wanting to talk about. And if there are any questions from our audience, please do pop a message in our comment box. But if there's anything that you think that we should still focus on, Dr. Klaassen, any aspects that you think is important as we start wrapping up the conversation, and also kind of what is the community-wide rabies prevention that we should be more aware of? What role does farmers play? What role does the agricultural community play to kind of control on a local level and on a national level?
Every one of us who own pets, whether it's dogs or cats, I think first and foremost, what we can do as community members is make sure that our dogs and cats are vaccinated and that we educate our neighbors about the impacts of a disease like rabies so that we make sure that their dogs and cats are vaccinated. And the more of a community stand together to make sure that we understand how the disease works, how can we prevent it and how can we keep our children safe? Because unfortunately, majority of the people who die of rabies are younger than 15 years old. It's kids who are dying. And it's tragic. It's something I don't want to wish upon anyone, and I don't want anyone to see children die of rabies. So it's as simple as making sure your dogs and cats are vaccinated and then educating your kids on good animal manners. I have a 2.5-year-old little girl, and I'm teaching her, how do you approach a dog? If a dog does this, it's scared, so don't play with the dog. If you don't pull its ears, if it's busy eating, leave it alone. If it's sleeping, don't scare it. So good dog manners prevent bites. And as Dr. Gabriel said, bites is how people get rabies. So don't cause unnecessary bites. Also teach your kids to come and chat to you. Like, Mom, on my way to school today, I saw a funny Timon, a meerkat, and it was chasing me. Then you're like, oh, that doesn't sound normal. So maybe we must go investigate this meerkat that was chasing my kid. So teach your children to speak to you. Teach them what is normal, what is abnormal. Make sure your dogs and cats are vaccinated. Make sure that there's community buy-in. It doesn't help that just you get everything vaccinated. Everyone must buy in. Sort of that whole herd immunity. So if majority of the dogs and cats in your area is vaccinated, your transmission is so much less. And if you have cattle or sheep or goats and you're in a high-risk area, speak to your state vet, like Dr. Gabriel and them are doing amazing work. They're aware of what's happening control disease-wise. It's so much bigger than just rabies, what they're doing with regards to important diseases with economic and zoonotic impact. Chat to your local state vet. Ask them, listen, Doc, what must I add to my vaccination protocol to ensure that there's safety? And if it's important, they'll tell you, listen, rabies needs to be on your list, and then you make sure that your livestock is vaccinated for that as well. So that's my 2 cents. Make sure everything that needs to be vaccinated is vaccinated. Educate. And then lastly, one I forgot is, if you are exposed, seek medical help. Those are the 3 key things that will save lives and make sure that no more people die or that we lose things unnecessarily.
Thank you so much for that, Dr. Klaassen. Last and final comments from your side, Dr. Gabriel?
Okay, just to add on to what Dr. Klaassen said, there is this term that we are using so much these days because I think it's something that we ignore so much as the farming community, including us veterinarians and animal health care workers, is biosecurity. Basically talking about preventing diseases coming onto your property. Because in South Africa, animal health is governed by the Animal Disease Act. It's an act of parliament that guides. In that act places equal emphasis or equal responsibility on the farm owners in terms of the health of their stock, the health of their animals. So as farmers, I think we need to put so much effort in preventing any animal disease coming onto our properties, onto our farms. So we need to put in good biosecurity measures, one of them being vaccination. Vaccines are actually cheaper compared to preventing or losing animals. Vaccinate our animals. Then maintain our fences. We need to maintain our fences so that there's no through fare through our fences, and even keeping wildlife out of our farmlands. If we receive new animals, try and separate them and observe them for some time before we integrate them into the rest of the herd, and many other things that we can do just to prevent diseases coming onto our properties. So that's one way that I just want to emphasize. Also, biosecurity. We need to put that word on top of everything that we do in our farming.
Thank you so much for all of this information. Our 2 speakers this evening was, of course, Dr. Didi Klaassen. She is the General Manager at AfriVets Training Service. She's also Vice Chairperson of the Rabies Advisory Group. And then as well, the last speaker that you just heard was Dr. Gabriel Murutero. He's a state veterinarian in the Eastern Cape and also part of the Rabies Advisory Group representing the Eastern Cape province as well. Any final comments, now, this is just like if someone has information that they need from you, how do they reach you? Where do they go to even contact this advisory group? How do farmers kind of play their role with connecting with the advisory group in their province, finding a representative? Thanks so much, Dr. Didi Claassen.
AfriVet, on our website, you guys will find awesome rabies resources. So there's a pamphlet that explains everything you need to know about rabies. So all you do is you go to www.afrivet.co.za, go to resources, and then you just scroll down until you see the rabies pamphlet. It covers everything from symptoms that you can look out for to what you need to do if you see suspicious animals, and then what you can do to educate yourself further on the disease. And then the Department of Agriculture has the National Department of Agriculture on their website. They have all the details of your local state vet. So I want to say your first point of contact with rabies is your local state vet. And I know not all areas or regions have local state vets, but there's animal health technicians and there's provincial directors that you can reach out to. And they usually then source information from the advisory group. Don't forget the importance of your local state vet. That's what I would say. Doc Gabriel, I don't know if you have other resources you can recommend.
The DAURAD website has got contacts and links to all the provincial agriculture departments.
Thank you so much to both of my speakers. Thank you so much for sharing information about this very important topic. And I think Food from Mzansi also continuously shares information through our campaign content that we've been doing with AfriVet throughout the year regarding this topic. So if you'd like to know more, you can also go onto the Farmers Inside Track channel, onto Food from Mzansi. There's a number of resources there to also tap into. Dr. Didi Claassen has been featured a number of times. Like I mentioned, she's part of the family already. From my side, Dawn Numdu, thank you so much. I know you work so hard, both of you. Thank you so much for the role that you play in literally saving lives and working with communities on the ground. So thank you so much to both of you for your time this evening. Everything of the best. Thank you so much to my speakers. Thank you so much to everyone who joined this live. Everything of the best and great rest of the evening to all of you. Bye-bye for now.